All right, we are now going to talk about different food labels and things to consider when thinking about food labels. The Nutrition Labeling and Education Act, the NLEA, gave the FDA authority to require nutrition labels on most food packages and also specified what should be included. This was passed by Congress in 1990 and then mandated by 1993. So, what this means is that for those of you who are alive before 1990, there wasn't anything mandating that every food that was produced had a label on it. And so many of you don't even know a world without making sure that there is labels on food, right? And so the goal of this was three-part. First, to minimize confusion. Second, to help consumers choose healthier diets. And then third, to provide an incentive to companies to improve the nutritional values of their products. Now, this was recently redone. The FDA introduced a new nutrition facts label in 2016, and many of you have probably heard of this. Not every food company has been doing it, but they need to be compliant by January 1 of 2020. So that's pretty soon. These are the major changes. First, there's an increased font size and bold type for the word calories and the term serving size. There's the addition of the actual amount of food included in addition to the percent daily value. There's also the addition of added sugars, the addition of vitamin D and potassium, as well as taking away vitamin A and C, the removal of calories from fat, and updates to the daily values for some of the nutrients. Now, we're going to see an example of that in a few slides, but now I want you to kind of think through some of these terminology and phrases that you might actually see on food packages. So health claims describe a relationship between a food or food component and the prevention or treatment of a disease or health-related condition. And if you think about the foods that you regularly buy, whether it's cereal or bread, you can commonly think through some of these health claims that exist on these packages. So there's this thing called qualified health claims, and they are allowed on a product label if there is emerging evidence, although not conclusive, for a relationship between a food or food component and a decreased risk of disease or health condition. So whole grain is related to a decreased risk of cardiovascular disease. So that's a qualified health claim. These statements must include a qualifying statement saying the evidence supporting the claim is limited. Nutrient content claims imply health benefits by describing the level of a nutrient in a product using terms like free or high, or comparing it to another product with terms like more or reduced. Sometimes healthy is used, and it's allowed if it has healthy levels of total fat, saturated fat, cholesterol, or sodium. So free, an example of free would be fat-free or high in omega-3s or anything like that, right? So you see a lot of these nutrient content claims on our food packages. Now they also have structural or functional claims, and these relate to a nutrient or dietary ingredient to normal human structure or function or describe a benefit related to a nutrient deficiency. So an example of this would be calcium builds stronger bones. It's kind of showing that there's a functional claim with calcium. It is regulated by the Dietary Supplement Health and Education Act, the DSHEA, and it typically applies to supplements and do not need FDA pre-approval. So that's not always a good thing. And no wonder why people are so confused. Even though it must have a disclaimer that it's not meant to treat, cure, or prevent disease and not regulated by the FDA, even though those disclaimers exist on the packaging, if they have in a larger font a big claim that it is going to lead to something, then people will see that and maybe not necessarily look at the disclaimer that's in smaller font. So now we're talking about big important things like the front of package labeling, what most people's eyes go to, right? Since 1987, when the American Heart Association first developed the Heart Guide Initiative, they actually did this to kind of tag foods that are quote unquote heart healthy, right? And it was done so in a good way. Well, then what happened is we had organizations like PepsiCo and General Mills that started to do similar things on their front of package labeling, and it was a way to try to communicate with consumers. While these were intended to help consumers make healthier choices, what ended up happening is because there were so many different multiple and varied labels, it ended up being actually confusing and misleading to many, many people. Okay, so in 2010, what happened is that the Institute of Medicine kind of developed this two-part report about front of packaging labeling, and it's supposed to help kind of minimize that confusion. Unfortunately, to date, no action has been taken on this, and it still kind of remains this rather ambiguous thing as far as what these front of package labeling actually means. So it's also really important that we know how to read a nutrition label, and maybe this could be part of the education that you give your client if they ask for it, right? If that's merited. So what we can do is we should be able to first determine the number of servings. Second, we should be able to calculate the total calories. We should also be able to look at the nutrient content, compare percent daily values where appropriate. If that person or you have any allergens, be able to look for that, and then carefully review the ingredient list. So this is an example, I know that's rather small, but you can look up examples in your book as well of a nutrition or a new nutrition facts label, and you can again see that the calories is much larger and in bold, as is the serving size. And it kind of nicely breaks down the different components that go into it and what you need to look for. And again, what you're looking for really depends on your goals and the behaviors you're trying to change. So this will look different based on what your client is trying to do. So let's pause here and do our last learning recap. The first question is, what were the goals of the Nutrition Labeling and Education Act? Secondly, I want you to be able to list 4 of the recent changes to the nutrition facts label. Third, what is the difference between a health claim, nutrition content claim, and structure function claim? And then lastly, what are some of the recommended steps you can provide a client when looking at a nutrition label? We will pause here and I will see you all in lab.